What's up guys, Ben here with EVO Performance Therapy, and I wanted to make a quick video to show you how I like to go about improving ankle mobility. So if you're someone that has had recurrent ankle sprains, if you have had previous injury to your ankle or lower leg, or if you just have tight ankles and you want to try to get them loosened up, this video can help. So give it a shot, let me know what you think. If you are someone that's experienced a lot of tightness to the calf or the lower leg, the ankle joint, and you've tried just smashing out your calves, rolling those things out, getting massages, and just none of the soft tissue work is working, then these few movements may just do the trick for you. So we're actually going to talk about improving the mobility of the joint versus just trying to loosen up the soft tissue. So when you think about the ankle joint, it's the talocrural joint is the name of it. So you basically have the top of your foot here, the talus is like a big dome, and then we have our tibia and fibula that sit on top of it like this. So it kind of sits here. They sit on top like that, and this thing moves. Now, if we have sprained the ankle joint a number of times, or even just once, we can lose the ability for the joint to slide and glide in here, and we really need to restore that. So to do that, I really like to use this banded mobilization. You may have seen this before. It's a great place to start, especially if you tend to feel pinchiness in the front of your ankle. That's usually more indicative of a joint restriction versus a soft tissue restriction. So if you were squatting or testing your ankle mobility or just getting that deep end range ankle position, if you pinch in the front, this will help alleviate it. So you're gonna take the band, and this part's really important. So I like to get a green band here. It's got a little more width to it, a little more surface area. And you're actually gonna place it on top of the foot below the ankle bones here. So these are called your medial and lateral malleoli. The band needs to go below these. If you're above these, we're actually not on the ankle joint and the band's not gonna be doing much for us. So band goes below the little ankle bones right there, right on top of the foot. And I like to elevate the foot slightly. You can go higher if you want, or you can go on the floor in a pinch, totally fine. I find this position is just more comfortable. So I'm gonna elevate my foot. The band's kind of pulling down and back, so it's actually causing that talocrural joint. It's actually gliding it back in the socket, and that mobilization force is what tends to open up the ankle. If it's feeling a bit stiff, takes that pinch away, which is what we're looking for. And so I'm just gonna keep my heel down, try to keep my foot relaxed, and drive my shin and my knee over my toe. If we do this correctly, should move pretty comfortably. And you can actually explore here. You may find that you have a little more mobility if you come in, but you're a bit stiffer going out. Try to find those tighter corners. Maybe drive in for a couple reps, then maybe drive straight over the middle of the foot, and maybe out, so I feel a little bit stiffer going out. I'm just gonna sit here and explore and just open up that range of motion. Spend about 2 minutes here. That can feel like a long time, but we can make some really meaningful changes, even if they're temporary. Make some good meaningful changes here with this mobilization. So give that a shot to start. But like I alluded to, if you do open up some more range of motion with that, it is temporary, but we can kind of lock in those changes with these next two movements. So once we've mobilized the joint, we can take it a bit further and add kind of a loaded stretch. A lot of times we do have some stiffness in the back of the leg, so think through the calf muscle here, the gastroc, the soleus, this really stiff part right here, and the Achilles can be tight. But we never can get a good stretch because the ankle joint itself is blocking us from even getting in there. So once we've cleared the ankle joint, now we can actually start to stretch out the lower leg musculature and open up even more range. So I like to use the same elevated surface. Apply a box, like a 20-inch or 24-inch box works great for this. Get a decent weight kettlebell. 35 works well for a lot of folks. 25 to 35 is about what you need. Keeping my foot or my heel down, my foot relaxed, I'm going to load my shin and my knee past my toe. And this kettlebell is helping assist with that. It's just driving the knee over, adding some extra weight. I can hang out here and actually get a pretty nice stretch without feeling the pinch in the ankle. I can actually get a stretch through the Achilles and soleus muscle. So I want to spend, again, 1 to 2 minutes. If you can tolerate, at least 90 seconds here, you'll see some nice changes. But just really start to spend some time at those end ankle ranges. This forward shin position is what's going to allow us to get into a pistol squat or just deep into a regular squat. That's really what we want to open up. And then lastly, once we have that, once we've done those two movements, it's always good to add some actual loaded movement. When I say loaded, We're not using any weight here, although that is an option, but just the load of your body weight works really well. Again, you can elevate the foot for this. We're gonna do a front foot elevated split squat, pushing the knee over the toe. The higher your foot is elevated, the easier it is. So if you do this on the floor, that's more challenging. If you do it on a plyo box, I can make it a bit easier. This is probably like a 6 to 8 inch box stacked off the ground. I'm going to get in a lunge position. And again, the goal here is not to go as low as I can, it's to drive my knee as far past my toe as I can. So if I'm here, I'm gonna put a lot of weight on my front leg, drive my knee past my toe, sit down without relaxing, that's key. Heel stays down, foot is relaxed, but shin is fully loaded past the toe, and I'm slowly gonna come back up. So this is gonna mimic the demands of the bottom of a squat. And that load really helps to lock in those range of motion changes we just made. So I like to do, 6 to 8 reps here. If that's super easy, you can always grab a pair of light dumbbells if you want to, but usually body weight is plenty. So if you're someone that struggles with ankle mobility, this combo, these 3 movements can really help open it up. Give it a shot, let me know what you think. Hit me with any questions in the comments below.